Hi, I'm Mariella. I'm the nurse
Hello.
practitioner student. I'm gonna do your head-to-toe assessment today.
Okay.
First, I want to check your vital signs.
Sure.
Just rest your arm. Perfect. Okay, so that was 115/64.
Okay.
Okay. And next thing I'm gonna do is I'm just gonna check your pulse really quick. Okay. Okay, so it's about 80.
Okay. Okay.
So the next thing that I'm gonna do is I'm gonna check the skin. The skin looks, the color is good. It's pink. I don't see any cyanosis. I don't see any edema, any scars, any wounds, any redness, any swelling. The next thing I'm gonna do is I'm going to look at the head. The head looks normal, normal size, symmetric. I don't see any signs of trauma. There's no bulging, no redness, no swelling. The next thing I'm gonna do is I'm going to palpate your head, okay, and I'm going to feel for any swelling, any bumps. I don't feel anything. I'm also looking at this, the texture of your hair pattern is normal. I don't see any bald spots or anything like that, okay? Next, I'm going to start with the eye exam. So first, I'm looking at your eyes. They look symmetric. Eyebrows are symmetric. Eyelashes, the upper and lower eyelids look exactly the same. There's no swelling, no redness, no discharge. I'm looking at the medial and lateral canthus. Again, no redness, no swelling, no discharge. Now I'm gonna flash a light at your eyes, okay? Okay, so just look straight. I'm looking for the pupils to react. Okay, good. Perfect, and it's equal. Also, the sclera is white. There's no redness. The corneas look exactly the same. Now I'm gonna look at the back of your eyes. I will turn the light off, but we can't turn the light off in this room. So I just want you to look straight to the back, and I'm going to flash this light in your eye, okay? I'm gonna get really close.
Okay.
Okay? And I'm checking for red reflex, any opacities, I don't see anything. Okay, and I'm looking at the nerve in the eye, the optic disc looks pink. Okay, I didn't see any AV nicking. Okay, we're gonna see the same thing on this side.
Okay.
We get pretty close again. Again, red reflexes. I don't see any opacities in the back of the eye. I don't see any nicking. I see the retinal, the arteries are red, and the nerve is the optic disc is pink.
Okay. Thank you.
You're welcome. So now that I look at the back of your eye, I'm going to check your vision.
Sure.
So first, I want you to tell me when you see my fingers. Okay?
Okay.
So tell me when you see them.
Yes, I see them. I see them. I see them.
Okay. And then next, I want you to cover your left eye, and I'm going to cover my right eye.
Okay.
Okay. And then tell me how many fingers I'm holding up.
1, 1,
Okay.
2,
Okay. And then let's switch eyes.
1, 2,
Okay.
1.
Okay. And then you can uncover your eyes. Okay. And then the other thing that I want you to do is I want you to look at my finger and just follow it. Okay. Continuing with my head to toe. So we just finished your eyes. Now I'm going to move on to your ears. Okay. So first I'm gonna check your hearing. So I'm gonna put this on the top of your head, and you're gonna tell me if you hear it better on the right or the left. Okay?
Okay.
Is it the same?
The same on
Both
both sides.
Okay, good. Then the next thing that I'm gonna do, that was the Weber test. The next thing I'm gonna do is the Rene test. I'm gonna put it on the mastoid bone, and you're going to tell me when it stops. Then I'm
Okay.
gonna put it right next to your ear, and you're gonna tell me if you can still hear it. Okay?
Okay.
So tell me when it stops.
Stop.
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 Okay, good. So it means that air is more than bone conduction.
Stop. Stop.
Wow, okay. So that is the Rene test. Now I'm gonna look at your ears.
Sure.
Okay, I'm going to press on the triggers.
Mhm.
Here, tell me if you feel any tenderness
pain.
or the mastoid.
No pain.
No? Okay, good. And the ear looks normal. There's no redness, no swelling, no signs of anything going on.
Sure.
I'm gonna look inside your ear. I'm gonna pull the ear back and up and look inside. And I'm looking at the tympanic membrane to make sure that it looks pale, shiny. There's no bulging. The cone of light is anterior, inferior. I can see the malleus. There's no bulging, like I said, no redness. I don't see any discharge. Okay?
Thank you. Okay.
And then the next thing on the other side, I'm gonna press on the triggers. Any pain?
No pain.
No. The mastoid?
No
No.
pain.
Again, the ear looks fine. There's no redness, no swelling, no discharge anywhere. And then I'm gonna look inside the ear again. I'm gonna pull back on up.
Mm-hmm.
And again, the tympanic membrane looks shiny, pale. There's no bulging, no redness. The cone of light is anterior, inferior. No redness, no discharge, no exudates.
Okay.
Okay. The next thing that I'm going to do is I'm going to examine your nose.
Sure.
The nose is midline. I don't see any discharges, and then I'm going to look inside your nose.
Okay.
Let me see. Do we have those black things? I'm just going to let's see them. You know what I'm talking about?
Yeah. I think I see something over there.
Where?
Over there.
Okay, I'm just gonna get those black things for the nose.
It's blue on top.
Oh, okay. Thanks.
Just getting a cover.
inside your nose. I'm gonna pull your nose up. And I'm looking at the color, the mucosa is pink. I don't see any deviation of the septum, no polyps, no discharges. Same thing on the other side. No deviation of the septum, mucosa is pink, no discharge. The next thing that I'm going to do is I'm going to press on the your sinuses, okay?
Okay, sure.
The frontal sinuses, and you're going to tell me if you feel any pain.
No pain.
And then the maxillary sinus.
No
any
pain. No
Okay, good. And then the next thing I'm going to do is I'm going to check your mouth.
Mhm.
First, I'm looking at the lips. The lips are pink. There's no, I don't see any like discharge or any signs of any like infection or anything like that. Go ahead and open your mouth and stick out your tongue. Let me get the light really quick. And stick out your tongue. And I'm looking at the back. Mucosa again is pink. Stick out your tongue for me. Good. There's no discharge. Lift up your tongue. When you look under the tongue, dentition is good. The sides are good. They're pink. No, like I said, no redness, no swelling, no discharge. So that's the throat exam. Now I'm going to do your, I'm gonna feel the lymph nodes before I move on to the neuro exam, the cranial nerves. So the first thing that I'm gonna do is I'm going to palpate the lymph nodes, okay?
Oh.
So I'm going to palpate the pre-auricle lymph nodes. I don't feel anything. Post-auricle. Okay. Occipital. Superficial cervical. Posterior cervical. And deep cervical. I'm also palpating for the tonsillar, submandibular, and submental. Good. Then I'm going to, and also the supraclavicular lymph nodes. Okay, all right. Then I'm going to stand behind you.
Sure.
I'm just going to feel your thyroid gland.
Okay.
I want you to pretend like you're swallowing water.
Okay.
And I want to make sure that it's symmetric and I don't feel any nodes in it. Go ahead and swallow again. Okay, and tracheus midline. Good. Okay, so the next thing that I'm going to do is I'm going to now check your cranial nerves.
Sure.
Okay?
Okay.
So I want you to tell me, the first nerve that I'm going to test is nerve number 1. I want you to tell me what you smell. Okay? So cover one nostril. Just pinch it. Perfect. What do you smell?
Alcohol.
Okay, and then switch to the other one.
Alcohol.
I'm sorry. That was cranial nerve number 1. Cranial nerve number 2 is just, again, the optic nerve, which we already did. We're just going to flash the light in your eye again, so pupils are reactive. Then cranial nerve number 3, 4, and 6. I want you to look at my finger and then follow it.
Okay.
And I want to make sure that there's no strabismus. Okay, so that's cranial nerves 3, 4, and 6. Cranial nerve number 5. I want you to tell me, close your eyes and tell me if you feel this in your face, okay? Me touching. You feel it? You feel it? You feel it? You feel it?
I feel it.
How about here?
I feel it.
Here?
I feel it.
Here, okay, and now you can open your eyes. And the second part of cranial nerve number 5 is I want you to frown. And then I want you to smile, show me your teeth, and then puff out your cheeks. Good. And then cranial nerve number 7, I'm just gonna touch here and I want you to clench your jaw. Okay, good. And then cranial nerve number 8, I'm just gonna put your hair behind your ears a little bit, okay? So I just want you to tell me if you hear anything, okay?
Yes.
Yeah?
Yes.
Okay. And then cranial nerve number 9 and 10, I just want you to open your mouth and say ah, and stick out your tongue.
Ah.
Okay, and the palate rises. You can close your mouth equally, and the uvula is midline. There's no deviation. Now cranial nerve number 11, I want you to push up against my hands. Okay, good. And then push against my face, my hand, all right, with your face, and then this side, good. And then lastly, cranial nerve number 12, I want you to open your mouth, stick out your tongue, and move it from side to side. Perfect, okay. All right, so now I'm going to move on to the rest of your test. First, I'm going to start with the back, okay? I want you to tell me if you feel any pain on this cervical aspect here.
I don't.
No? I'm looking at the back. Also, I'm looking to see how the lungs are expanding. They're expanding symmetrical. I'm just going to put my hands on you, okay? And I want you to take a deep breath. Okay, so lung expansion is symmetrical. Sure, you can take it off. That's fine. Okay. All right. So now I inspected your back and I looked for symmetry. I'm going to palpate, okay? And you're gonna tell me if you feel any pain. You feel any pain?
No.
Okay. And then I'm going to percuss,
Okay.
okay? Okay. And then after I percuss, I'm going to listen to your chest, to the back, okay? Actually, before I listen, I'm gonna put my hand here and I want you to tell me, say 99 every time I switch hands, okay? Go ahead.
99, 99, 99.
And this is for tactile affirmatives.
99, 99, 99.
Okay, and then I'm gonna do the same thing with my stethoscope. And you're gonna, when I switch places, you're gonna say 99, okay?
99, 99, 99, 99, 99, 99.
Okay. And then I'm just gonna listen now, so I want you to take a deep breath through your mouth and out of your mouth every time I switch positions, okay? Take deep breath, okay? Okay, good. And the last thing that I'm going to do while I'm back here is I'm going to check for tenderness of the costovertebral spine. So I'm just going to punch and then you're going to tell me if you feel any pain, okay?
No.
Any pain?
No.
No, no pain? Okay, so now you can come back around. Alright, so the next thing that I'm gonna do is, I'm looking at the patient, I'm looking at the AP to lateral, the diameter, and it looks normal. I'm looking at the color of the skin, I'm looking at the symmetry, chest is rising equally. I don't see any retractions, I don't see any bulges, I don't see any pulsations. Now I'm going to palpate your chest.
Okay.
And you're gonna tell me if you feel any pain.
No pain.
Sorry.
No.
Pain. No pain. Sorry. No pain?
No pain.
Okay, all right. And then the next thing that I'm going to do is, again, I'm going to listen to your chest now. I'm going to, yeah, listen to your chest.
Mhm.
Right, okay. So I'm going to go in the second intercostal space, and that's going to be the aortic. Okay. And then again, the second intercostal on the left side of the sternum, that's pulmonic. And then the fourth intercostal. Oh,
Yeah, it's
Sorry.
okay. It's okay.
fourth intercostal space, sternal, that's tricuspid. And then the fifth intercostal space, midclavicular, that's your mitral. Okay, and I'm gonna listen with the bell as well, in the same spots, for any murmurs. Okay, and then if you can just lean forward for me. And hold your breath. Okay, I don't hear anything. So now I'm going to listen to your lungs,
Mhm.
okay?
Mhm.
Take a deep breath through your mouth, and out your mouth. And I'm gonna listen over here, underneath your arm. Deep breath. Okay. The other thing that I'm gonna do is I'm going to feel for the pulse here, the aorta on both sides. The carotid pulse here. And I'm going to hear for any bruise. Okay, so I looked at your chest, I palpated, I listened, and now I'm going to look at the your circulation, okay? I'm feeling your pulses, make sure that they're equal bilaterally. I don't see any cyanosis, no edema. I'm looking at the pulses here to the dorsalis pedis. Okay, and they're equal. Again, no cyanosis, no edema. Okay. The next thing that I'm going to do is I'm gonna have you lay flat on your stomach. I'm going to assess your stomach. Okay. So the first thing that I'm going to do is I'm going to look at your abdomen. It looks symmetric. I don't see any bulging, any redness, any swelling, any sign of the color is uniform, no scars, no pulsations. Okay. So after I look at it, now I'm going to listen to it. Okay, so after I auscultate it, now I'm going to palpate your abdomen, okay? First I'm going to do light palpation, and I'm going to move on to deep palpation, okay? So I'm going to start here. You're going to tell me if you feel any pain. No. And as I'm palpating, I'm feeling for masses or any bulging. Okay, and now I'm gonna do deep palpation, okay? Okay, now I'm going to percuss your liver and your spleen.
Okay.
So go ahead and put your arms just up here, this way.
Okay.
Okay, and that's probably. Just hold this up. Percuss your spleen.
Okay.
See if I can percuss it. Okay, and then I want you to take a deep breath. I want to see if I can palpate your liver. So take a deep breath and hold it. Okay. All right, and then I'm going to see if I can palpate your spleen. I'm sorry.
You're ticklish.
Take the breath and hold it again. All right. Now I'm going to listen for the aortic vessel, and then your renal, and then femoral and iliac. And I'm listening with the bell. Okay, so that concludes your abdominal exam. You can sit, if you can sit up for me.
Sure.
The next thing that I'm going to do, now that we did your cardiac or respiratory, your belly, now, if you want, you can put that back on. That's fine. I'm going to assess your muscles.
Sure, no problem.
So go ahead and take a seat. Oh, you have to go to the bathroom?
Yeah.
Okay. I'm gonna stop so you can go to the bathroom. So just pause.
Yeah.
Where's the pause? Over here.
You can go ahead.
It's going. Okay. So now let's check the range of motion. Okay.
Sure,
So I just
okay.
need you to lay back down again.
Sure.
Watch your head. Okay. Good. So I want you to bend your knee. Okay. And then just swing your leg over to that side, okay? And then to the outside, okay? And then extend your leg, and then do the same thing to the center. Move your leg to the center, okay?
Okay.
And then to the side, to the lateral side. Okay,
Okay.
good. You can put your leg down, and then do this leg, bend your knee, okay? And now swing the leg inside, okay? And then outside, okay? And then extend your leg. Okay, and then swing to the inside. Okay, and then swing to the outside. Okay, good. Now you can sit up for me. And then come all the way to the edge of the bed. So now I'm going to check your knees.
Okay, sounds good.
So I just want you to extend your knee and then back. Okay, and then swing it inside, and then swing it outside. Perfect. And then do the same thing with this one. Front and then back. And then in, okay, and then out. Okay, perfect. And now your ankles, I'm gonna test the range of motion.
Okay.
So yes, put your foot up and then down, and then put the tip of your toe point in and then point out. Okay, perfect. And then do the same thing here, up and then down. Okay, and then in and then out. Okay, so you have full range of motion in your knees and your ankles. So. Now what I'm gonna do is I want you to I'm gonna check the motor strength. So I want you to push up and try to resist me. Okay, good. And then push down. perfect. And then push up, and then push down, good. And then push back, and push forward, perfect. Push back, push forward, good. Push up, push down, perfect. Push up, and push down, all right. So that was range of motion, motor strength, and I'm going to check and see for sensation, okay?
Sure.
So I'm going to have you close your eyes and just tell me if you feel something sharp or dull.
Okay.
Okay, so go ahead and close your eyes. Tell me what you feel.
Oh, sharp.
Okay,
Soft.
okay. And cross your legs, okay.
Sharp. Soft.
Soft, okay, that's good. And keep your eyes closed. And then I'm going to put something and you're gonna tell me what you feel, okay?
Okay. Vibration.
Okay, perfect. And then cross your legs one more time for me. Thank you.
Vibration.
Perfect, okay. So we did sensory, and that concludes the lower extremities, motor strength and sensation.
Thank you.
That's it. And then I'm going to check your arm. It's okay, the
Sure.
range of motion. So I just want you to put your arms like this, both of them, okay, and then swing them back. Okay, perfect. And then just bring them back again. Okay, to the sides, and then take your right arm and try to reach the back. Okay, good. And then reach again, and then just swing across like this. Perfect. Okay, and then with your other arm, do the same thing. Across, go across, and then swing it back, and then try to reach the back. Perfect. So that's range of motion. Then I want you to resist me pulling. So put your arm like this, like you're making a bicep, okay? And then resist me pulling, and then resist me pushing, okay? And then, yeah, resist me pulling, resist me pushing, okay? And then I'm going to try to push down, so push up with your arm, okay? And then the same thing here, push up, push down, okay? And then take my hands and squeeze them, okay, good. Put your arms like this and push down, and then turn your hands up and push up, okay, good. And then just go like this with your hands, and don't let me put your fingers together, okay? Good, okay. So that's your range of motion and your strength. Now I'm going to test to see if you can feel different kinds of sensations, okay? So I want you to close your eyes and just tell me if you feel sharp or if you feel something soft, okay?
Oh.
So,
Sharp. Soft.
okay,
Sharp.
okay. That's fine. Wait,
Soft.
soft, okay?
Sharp. Soft.
Okay. And then I just want you to, I'm gonna put something on your leg, and I just want you to tell me what you feel, okay? So you can close your eyes and keep your legs right next to each other, like that. Okay, good. And what do you feel?
Oh, I'm sorry.
What do you feel?
Vibration.
Okay, that's it. That's all I'm testing for, just vibration. So now that we did that, I just want you to tell me, I'm checking your mental status, so just tell me the date today. We know it's December or something.
December.
What's today? What's today
Today's December 17th, 18th?
Yeah,
I think it's 18th.
I think it's 18.
The 18th. Today's Friday, December 18th,
Okay.
2015.
All right, and what are we doing today?
We're doing our physical final assessment.
Okay, perfect. And so you're alert oriented times 3. And so then the other thing that I want you to do is take your heel and have it go across your shin, okay? And then the other one, okay, good. And then the other thing that I'm gonna test is I want you to put your finger to your nose and then just follow and tap my finger, okay?
Okay.
Okay. Tap your nose, tap my finger, tap your nose. Okay, good. All right, we're almost done. I just want you to stand up for me and then pretend that there's a black line right there and just walk along the line. And I'm just testing for your gait, and it's a normal gait. And then turn around, and then when you come back, I want you to walk heel to toe. So heel to toe, perfect. Okay, and then walk back on the tip of your toes. Okay, and then walk in on your heels. Okay, and then I want you to just stand right here, and I want you to put your feet together and close your eyes. And I just want to see if there's any shifting to any side. Okay, and then just put your arms out for me. Okay, and I'm gonna push down. Okay, ready? Okay, so that's negative. Go ahead and open your eyes. That's fine. That's negative rumble. And then the last thing that I'm gonna do to check your range of motion is I want you to bend, and I want to look at your back, the curvature. Okay, so just bend, and I'm looking at the back to make sure that it looks symmetrical. Okay, good. And you can come up now. You can come up. You okay? All right. And then the other thing that I want you to do is move side to side like this. Okay, and then side to side like this.
That feels good.
And then try to go back as much as you can. Okay, so you can take a seat, and I think we are done with your head-to-toe assessment.
Okay.
All right,
Thank you.
that's it. Should I pause it?
Pause it.
Okay, one last thing I forgot to do was do your deep tendon reflexes.
Okay, sure.
So I'm gonna check. Let's pull this up. So I'm going here where the muscle inserts. I just want you to relax your arm, okay? That's normal.
Okay.
And then the triceps. Okay. And then the radial. Is that real? And again, the same on this side. Yeah? Sure. Okay. Okay, and then I'm gonna check your tibial. Just a second, thank you. Okay, and then the Achilles.
Let me take off my shoe.
No, it's back here. Usually your toe is supposed to.
You want me to take it off?
It's fine. And then if you take out your shoe, then I can check your Babinski
Oh, yeah.
reflex. We can do it over the side. It's fine.
That's ticklish. I'm very
the
ticklish.
other,
I'm sorry.
the other foot for Rubinsky, and it's gonna be negative. I'm sure. Okay, that's it. And that concludes our head-to-toe assessment.